Hey guys, this is Thomas from NurseMoneyTalk, and in this video, I want to talk about something that I recently just kind of found out, and which is that I guess there are some nursing students who take the ACLS or think about taking the ACLS while they're in nursing school, thinking that it will help them for after graduating nursing school. And so I found that actually kind of interesting. And so what I want to do in this video is actually talk about that and honestly give my 2 cents on whether or not I actually think that's that's a good idea. But before I get to that though, I want to go ahead and invite you to subscribe if you aren't already subscribed in this channel. Talk about pretty much all things nursing. And if you find this video helpful, don't forget to hit that thumbs up. Or if you know somebody who's thinking about the same thing, make sure to, I would really appreciate it if you would actually go ahead and share this video with them. Let's go ahead and get started. And that is, let's first talk about what exactly the ACLS is in a nutshell. So the ACLS in a nutshell actually stands for Advanced Cardiac Life Support. And it's pretty much a course by the American Heart Association that's geared towards pretty much like medical or healthcare professionals who care for patients who go into like some kind of cardiopulmonary arrest or any like cardiovascular emergencies. What the ACLS does is pretty much kind of teaches you a set of clinical like algorithms or steps you can use in such emergencies. So that's in a nutshell, simplified. That's pretty much what it is. Like common example of medical professionals who that immediately comes to mind who would be using or who would have to have ACLS certification are like ICU nurses, so intensive care unit nurses, and like emergency room nurses. So as for some of the reasons why I've seen that nursing students are wanting to take the ACLS is that they think that it's going to help them stand out and look good when they're applying for jobs. And so that seems to be the main reason. If you know of something else, I'd be curious if you'll go ahead and let me know in the comment section below. But that's pretty much the primary reason that I'm working with here. You know, the thing about that though is that when it comes to helping you get a job or helping you stand out, I'm not quite convinced though that it's actually going to give you that desired effect for a couple of reasons. The primary one being that one, you're not using it. Like the thing about being ACLS certified, and this is, because I have ACLS certification, and that's like, it's one of those things, honestly, it's almost even similar, it's pretty much similar to the, to BLS, and that's like if you're not using kind of like the skills, then it makes it really hard to really remember it when you need it, especially if it's like few and far between that you're actually like getting involved in codes or for as the BLS is concerned, like chest compressions or anything like that. And even like to that extent of not using it, like even like the facility that I work for is trying to kind of push for having like staff members take some kind of a little bit of a quick refresher every so many months just to make sure that skill set is constantly being worked. And so if, as I see it, if facilities have that kind of an issue trying to keep, like nurses who are, or staff members who are ACLS certified, like up to par on those skill levels, then, I kind of wonder as a nursing student, when you're not really even in the daily grind, how useful that would be for you. On top of that, to get the ACLS, it's kind of expensive and it's kind of time consuming. It's not super expensive, but I think I think for the combo I paid a couple $700, like $200 or $300 or something like that, I think is what I paid for. And, and then like you have to take some classes and everything else. You know what? I think that money would be better off spent on either an NCLEX prep course or like some study aids for nursing school, which, as an FYI, I have like links to some great resources in the description below. But I think your time and money and resources would be better spent there. And kind of like the last point that I think about is that when you graduate and if you actually get into a job that requires ACLS, because here's the thing, not every job requires it, your employer will probably end up paying for it or giving you time or something like that to where you can go take the classes, get the certification using their resources, so it doesn't really have to come out of your pocket. And so like if you are just like at a point where you're just like super concerned and just stressing about how you can help yourself stand out, let me give you 2 things that I think will probably be a little bit more kind of helpful than this, I think, in my personal opinion. One is that if you are in one of the few states where you can get your LPN as an RN student, I think that's something that you should probably consider before the ACLS. I have a link that I'll put up there. And so you can go check that out where I talk about more about what my thoughts are about getting the LPN as an RN student, or as they say, being able to challenge the LPN exam as an RN student. So definitely check out that video up top. The other thing that you could look at is by joining a professional nursing organization. There's a lot of them out there. I feel like I don't reference or talk about them enough on this channel, but I think there's a lot of benefits to them in terms of, especially like the big ones like ANA that in a way kind of helps lobby for rights and benefits on the political spectrum for nurses. But as far as I'm concerned, specifically with this in terms of helping you get a job after graduating, is that it's a great opportunity to network. Because think about it, what if you want to get into the ICU, right? And you join one of those nursing organizations and you're able, and you just happen to come across with a nurse manager at maybe one of the ICUs in the city or area that you live in. And then you're able to kind of network, or maybe not the manager, but they work at one of the ICUs, or you meet a nurse who works at one of the ICUs, and then they can put in a good word for you or something like that, where like you can then start kind of growing your network and almost kind of like your sphere of influence. That alone, I think, will probably make so much more of a difference in terms of you getting a job than getting your ACLS as a nursing student. So yeah, that is all I got for this video. Let me know what your thoughts are in the comment sections below. Don't forget to hit that thumbs up. Share this video if you know anybody who you think would benefit from it, and I will catch you very soon in that next video.